Hello and welcome to How to Manage Your Diabetes Better by Improving Your Self-Care. My name is Victoria and I've been a registered dietitian for almost 10 years now. I received a bachelor's from Purdue University in Dietetics, Nutrition, Fitness, and Health. And I have worked the past 8 years in long-term care, of which 6 were clinical management. And at this moment, I'm working towards a graduate degree in applied nutrition. So, what we plan on discussing today. Our focus will be a particular aspect of diabetes self-management. First, I will address some of the long-term health consequences of unmanaged diabetes or unmanaged blood sugar. We'll discuss what exactly high and low blood sugar feel like. However, also I will make emphasis on the fact that it's very important to actually measure your blood sugars to get an exact number. And I will also explain why in more detail. Followed by, I will also explain the 2 basic types of carbohydrates. Carbohydrates, that topic tends to get a little confusing and messy. I'm going to try to keep it simple and straightforward. And to wrap up, I will talk about the importance of regularly seeing your diabetes clinicians, because diabetes does tend to get complicated pretty quickly, but it is very doable to control your blood sugars and manage your diabetes if you especially employ the help of your diabetes clinicians. So, that being said, let's discuss what is diabetes. It is basically a disease where the body cannot digest sugars and starches, otherwise known as carbohydrates or carbs. When that happens, sugars basically float around the bloodstream and don't get metabolized into energy or stored as energy or as fat. When sugars are just floating around in the bloodstream for a long duration of time, there are quite a few negative effects to one's health. That being said, diabetes is a condition which needs to constantly be managed. There is possibility for remission, however, that is only if you follow an extremely strict diet and follow, adherence to proper medication doses. Also, exercising, essentially being very, very strict, can cause diabetes to essentially, it won't be cured, but it can be in remission, as in you won't need to take any medications or measure blood sugars. But meanwhile, the focus is to manage it. How does diabetes develop? Basically, it comes from a sedentary lifestyle and poor eating habits. Poor eating habits include eating too much sugars, starches, but also eating just too many calories of any kind of food in general. It tends to overload the system. If you, for example, have a healthy diet, the body pretty easily digests foods that have sugars in them. This is done by a hormone that's called insulin, and insulin's job is to convert that sugar into energy or store it as fat, which is essentially energy for the future. However, when there's too much blood sugar floating around the body too often, the insulin stops working as well as it once did. And the reason this happens is the more and more insulin is needed to digest the sugars from the blood. And there comes a point when there's so much insulin being secreted on a regular basis, the body eventually stops noticing it or responding to it. That's why the insulin that is secreted doesn't work. And it's a term called insulin resistance, which you may have heard. And basically, the insulin that your body produces stops being able to remove the sugar from the blood. That's where people start to have to take artificial insulin. If that isn't done, sugar floating around in the bloodstream just continues to do so, and this is very harmful to the body. So the harm has some pretty long-term consequences that don't happen overnight, but are pretty severe. For example, blindness, because eyes are damaged, which is unexpected from blood sugar. However, when your blood doesn't function properly and circulates, all sorts of bad things can happen, and high blood sugar causes the blood not to circulate well. That can also cause numbness of the hands and feet, which tends to start with tingling from the lack of blood because circulation is poor. If this is ignored for many years, it can end in amputation of a limb, like a foot or a few toes, because the tissue essentially dies. Even more severe is when the kidneys stop working. This is because kidneys filter blood, and if they filter too much blood with high amounts of sugar, they essentially stop working. They cannot get rid of waste, and this leads to a very uncomfortable lifestyle of dialysis. Generally speaking, 10 to 20% of people with type 2 diabetes will have kidney failure. However, I want to stress that this is very, very preventable. Keeping blood sugars under the control, even if they're not perfect, will prevent kidney failure. We're talking people who just go for days, months, maybe years with just consistently elevated blood sugar. And finally, probably the most severe is a diabetic coma. If the sugar is just so high, the body just can't handle it. So let's discuss what exactly high blood sugar looks like. So your body has a response to when this happens, and some of these signs and symptoms could be frequent urination, which comes from extreme thirst or dry mouth. Also, sweet, fruity breath is also a sign of high blood sugar. Then there's some more generic effects like dizziness, tiredness, fatigue. Those are kind of hard because those can happen for a number of other reasons. However, blurry vision is also a pretty specific one, as well as maybe feelings of nausea and vomiting. Another long-term effect is slow healing cuts, which is something that is noticed over time. So why does blood sugar tend to be high for some people? This happens when you eat too much food at once. And this isn't just sugar and starch. This is any calories. You don't exercise, so the body doesn't use the sugar for energy. It still floats around. Not taking medicine, which helps lower sugars, can cause them to be too high, as well as taking the wrong dose of medicine, which is, not enough. On the opposite end of the spectrum, we have low blood sugar, which is also not a good thing. This can be dangerous because in worst case, it can make you just pass out, lose consciousness. But also a number of other unpleasant side effects is sometimes a sudden change in mood, weakness, rapid heartbeat, confusion, blurred vision, and slurred speech all are pretty intense symptoms. Then just general clamminess, sweaty, shaky, feeling drowsy and tired. Again, drowsy, tired is a tough one to kind of go by. And finally, dizziness. So you also do not want your blood sugar to drop, especially if you're in the middle of something, doing activities and such. The reason blood sugar drops with diabetics is you maybe didn't eat enough. You maybe skipped a meal, and essentially too much time had passed between meals. Your body used all the sugar it had and it dropped too low. It's possible you might have exercised and didn't eat. Your body needs more energy when exercising. Drinking too much alcohol. Alcohol is a type of sugar, so that can also have that type of effect. And also taking too much medicine, which is meant to lower blood sugar, can drop it lower than preferred, which again is very important to have your medicine be prescribed by a clinician and for them to constantly reassess, is this medicine in the correct amounts for you? And I will touch up on that in a little bit. In general, low blood sugar is pretty dangerous. So if you do have a reading that's less than 70 milligrams per deciliter, it is a quick fix. You can fix it with a quick light carbohydrate snack, like a cracker, graham cracker, saltines, Ritz, something drinkable, sugar, milk, juice, that kind of stuff will really quickly elevate the blood sugar. So with all of that being said, even though we touched up on all the symptoms, kind of brought to awareness what these things may feel like, I would really like to stress how critical it is to monitor your blood glucose with an official apparatus. This is called a glucometer. You'll end up getting one. You can get it at CVS or your clinic may provide one. The symptoms mentioned in the previous slides of high and low blood sugar should be used as a hint. They indicate that it's essentially too late and that blood sugars are either too high or too low. So treat them as a last resort. Not to mention, most people do not correctly guess what their blood sugar levels are, even if they have a hunch. Also, officially checking your blood sugars, it really is the only way to tell if certain changes in health that you make are working, like, the typical change in your diet, your exercise, and medication dosages. A little more detail as to what your blood sugar tells you in terms of your health and what you're doing includes whether your medications are working the way they should, which is very important because most of the medications you take for diabetes lower your blood sugar. So if they are not properly working, if the blood sugar is still high and you're taking a medication, this would be an opportunity for you to go to your clinician and have them maybe adjust your medication dosages, or it may be a sign for you telling you that you are eating too much. So essentially, it's also a gauge of the effect, the type of food you eat, as well as how much of it is affecting your blood sugar. So sometimes, it's easy to be in denial if you're eating, cakes, cookies, etc., probably thinking, it's not that bad. But once you straight up check your blood sugar and see that number, it is very eye-opening and could serve as a great motivational factor. Also, activity or stress can affect your blood sugar, particularly, physical activity takes more sugar, things like that. It can also explain a mood swing or a drop in energy. Essentially, the more you check your blood sugars, the more you can catch on to what may be causing a drop or a spike. So basically, it's a way for you to continue to become familiar with your body. That being said, checking blood sugars needs to be guided and supervised by your diabetes medical team or diabetes educator, and this has to happen continually on a regular basis. Your diabetes team or educator can consist of a doctor, nurse, pharmacist, and or registered dietitian. It is their job to assess your numbers and to make adjustments to your diet and your medicine doses. This is an ongoing learning process, and your team is here to help you grow and maintain your knowledge and skills as to how to more skillfully measure your blood sugar. Their job is to show you how to measure your blood sugars with a glucometer, and make sure you're doing it correctly, because it could take a few sessions to get the hang of.